COVID-19 treatment method. Hospital treatment plan. At present, effective antiviral drugs for pathogens are lacking, and isolation therapy and symptomatic supportive therapy are the mainstays. According to the Pneumonitis Diagnosis and Treatment Program for New Coronavirus Infection, Trial Version 7, issued by the National Health Commission, for severe and critical cases, on the basis of symptomatic treatment, actively prevent complications, treat basic diseases, prevent secondary infections, and provide organ function support in a timely manner. Take the following treatment: respiratory support, including oxygen therapy, high-flow nasal catheter oxygen therapy or non-invasive mechanical ventilation, invasive mechanical ventilation, and rescue therapy. Salvage treatment. For severe in patients with ARDS, it is recommended to perform lung expansion. With sufficient human resources, prone ventilation should be performed for more than 12 hours the next day. Prone position. Those with poor ventilation, if conditions permit, should consider external membrane pulmonary oxygenation (ECMO) as soon as possible. Circulation support, based on adequate fluid resuscitation, improve microcirculation, use vasoactive drugs, and perform hemodynamic monitoring if necessary. Get on non-invasive or invasive hemodynamic monitoring. During the treatment process, pay attention to the fluid balance strategy to avoid excessive and insufficient. Renal failure and renal replacement therapy. In addition to finding the cause of renal failure, continuous renal replacement can be selected for severe patients with renal failure. Generation therapy (CRRT), restored plasma treatment. It is recommended for patients with rapid disease progression, severe and critically ill patients. For usage and dosage, please refer to the recovery period of recovering patients with new coronary pneumonia. Clinical plasma treatment plan, trial version. Blood purification treatment. The blood purification system includes plasma exchange, adsorption, perfusion, blood plasma filtration, etc., which can remove inflammatory factors, thereby reducing light inflammatory response to the body. Damage can be used for early and mid-term treatment of cytokine storms in severe and critically ill patients. Other treatment measures. Intravenous infusion of gamma globulin can be considered in children with severe and critical cases as appropriate. Pregnancy. With severe or critically ill patients, the pregnancy should be actively terminated, and a cesarean delivery is preferred. Patients often have anxiety and fear, and psychological counseling should be strengthened.